Millions of people in the United States live with an eye condition that can cause blindness if left untreated. Age-related macular degeneration, or AMD, is one of the most common, but can be stopped and or even slowed if you catch it early enough. Joining us this morning to talk more about it is Dr. Talia Caden. Doctor, thanks for joining us today.
Thank you so much for having me.
Well, let me first of all start off by asking, what exactly is age-related macular degeneration?
Sure. So macular degeneration, or age-related macular degeneration, is a very common disease that affects over 20 million Americans. And it's a disease in which the back of the eye, known as the macula or the retina, which is the part of the eye that helps you to see clearly, can develop abnormal blood vessels, which can leak and bleed and cause vision loss.
Now, what are some of the risk factors and symptoms that people need to be aware of?
Sure. So the risk factors, as the name kind of implies, is age. So one of them is anybody over the age of 60 is at higher risk. Women are at slightly higher risk. And then patients who are people who have hypertension, are overweight, or smokers can be at a little bit higher risk, as well as anybody who has a family history of the disease. So knowing that information can be helpful. In terms of some symptoms that you can look for, one thing we always recommend is patients or people take a look, and if they see straight lines that should look straight but start to look wavy, so your bathroom tile, your curtains, the flagpole, that's a really important signal that you need to go and talk to your doctor. But also just some more general things like blurred vision, especially blurred vision in the center of your vision. So if you're looking at your family member's face and it starts to look blurry, you want to go and make sure you see your doctor soon.
So what are some of the treatment options that are out there and available?
So the mainstay of treatment is actually an injection of medication into the eye, and there are a number of different options. The most recent medication to be approved is a medication called Vabysmo. But again, there are a few different options, so you want to always make sure you're talking to your doctor to choose the option that's best for you.
So if we have some older adults out there, or even caregivers who want to know more about it and obviously want to know about prevention, what should they know now to help out?
So the most important thing we really always want to reinforce is everybody should be seeing their doctor every year just to get a baseline exam. And then if you notice any of these symptoms, or if the person you're taking care of is starting to complain that things look different, you want to go in. Don't wait, because the earlier we can identify that there's a problem and the earlier we can start treatment, the more vision we can maintain. So that's the first and most important thing, is really pay attention to what you're seeing and what the people you care for are describing. In terms of resources that you can use, so for the medication that I mentioned, there's a great website, vabysmo.com, but there are also great websites available that just tell you more about macular degeneration. So I always recommend the American Academy of Ophthalmology, whose website is aao.org, or the American Society of Retina Specialists, so asrs.org. And both of these websites have really great handouts or pamphlets that you can even print out, and that'll tell you a little bit more about the disease.
Well, Dr. Talia Caden at the Manhattan Eye, Ear, and Throat Hospital, we thank you so much for your time today. And I want our viewers to know that this story will be on our website, mywabashvalley.com, for all those additional websites you mentioned, because obviously, as we know, it's very common, and we want to make sure our viewers are getting the most important information. Doctor, thank you so much.
Thank you for having me.